another episode of Face the Future. Today we're meeting Dr. Michelle Copeland. She's the first female plastic surgeon in the U.S. who has a combined degree in both dentistry and medicine from Harvard. Pretty impressive. Let's go inside, class. So we're here inside Dr. Copeland's offices now, and she is the author of several books about skincare. She has her own skincare line, and today she's going to show us something really special. It's called the combination treatment, and it's a process that involves microdermabrasion, lasers, and ultrasound. Follow me. Today we're here in the offices of Dr. Michelle Copeland, and she is an expert in non-ablative skin rejuvenation treatments. Did I get that right?
You absolutely did.
Now, what does that mean?
You know, we're entering a golden age in plastic surgery where we can actually make people look better without any downtime.
Today you're going to show us the combination treatment. What does that consist of?
Yes, this is a treatment that I developed using a stacking method or a combination of treatments. So they're all little steps that when put together become more powerful. It really takes a very short amount of time, probably less than 15 minutes. That's why we call it the lunchtime quick fix.
I'd like to see it done. You want to do it?
Absolutely.
Okay, so we're here in the procedure room now. We're with our volunteer, Cynthia. Are you ready?
I'm all ready.
So today we're going to start with the microdermabrasion, which is the sanding of the skin almost imperceptibly. Now Cynthia has had some numbing cream on. You have a little redness, so I go all over. When I finish, you're going to see, and you can even feel how much smoother the skin is.
It's sort of relaxing.
It does. It actually feels good.
So the next step is we're going to do some ultrasound in the neck because she has some fullness here, and we're going to see if we can get a remodeling of that fat. And again, because I did the microdermabrasion, it makes the ultrasound penetrate a little more deeply. After the procedure, she'll have some topical hydrocortisone put on to help with the redness, and she'll have some ice. And then she'll be able to put on makeup and go right back to work. Now the next step is the laser. And what we're going to do is we're going to apply some black pigmented cream on her face that the laser is going to pick up.
These are to protect my eyes from the lasers. Let's do it.
It's a very fast procedure. All over the face. The next step is going to be the intense pulse light. Now I'm wiping off any residual black cream that might remain. This is the IPL, called intense pulse light, and this gives you a diffuse light. The IPL is not a laser, so it's diffuse light that stimulates collagen. And now we're going to clean off her face, and then she's going to have the final step, which is that LED. There's absolutely no discomfort. She's feeling nothing, and it's almost very pleasant to be sitting there. We're learning how to modulate light and make it effective in stimulating our skin and our collagen.
Okay, doctor, so we're done here, right?
That's right. Now after this, Cynthia will ice a few minutes before she applies her makeup, and she might decide to do a little Botox or fillers in conjunction with this.
Okay, Cynthia, so let's take a look at Dr. Copeland's treatment, how it worked out. What do you think?
You know, it's amazing. It's a nice flush to my face. I feel wonderful. It looks beautiful and smooth. It feels smooth, and I even feel different.
Well, you just look amazing. And how old are you again?
Do I have to really say I'm 60?
Wow. Wow. Dr. Copeland working some magic here.